And just, if the worst does happen, what are the signs of an asthma attack that merit a trip to the emergency room?
Well, direct indications to go to emergency room is shortness of breath that requires albuterol use more than every 2 hours, or simply respiratory distress, difficulties breathing, inability to breathe well. But if somebody needs to use albuterol every 2 hours or less, actually this is an indication to go to the emergency room, especially if we are not able to reach our physician. So any form of respiratory distress or albuterol use more frequently than every 2 hours is an indication to go to the emergency room. But most of the time, there are plenty of signs of impending asthma exacerbation. And if we just remembering that if we have asthma symptoms more than twice a week, and their frequency increasing over the past few days, should put us on a high alert. Most patients with asthma should also receive the so-called asthma action plan. Children above the age of about 7 years are able to do peak flow measurements at home, and every asthmatic should know what is their peak flow value when they're healthy, and monitor the peak flow values when they feel worse or start feeling sick. When asthma gets worse, usually the peak flow values fall down, and patients with asthma action plans will have specific numbers provided for acceptable range of their peak flow values, and when they should get nervous, and what would be the indication to go to the emergency room. It's worth mentioning here that if the peak flow value drops 20% from normal, this is a obvious sign of concern. That means that the asthma is getting worse, and there should be a plan of action in such a case. If the peak flow value reaches 50% of the norm, this is also an indication to go to the emergency room. So visiting the allergist should also include long-term education of the family and the patient, and receiving a peak flow meter and asthma action plan, and to know how to anticipate an asthma exacerbation. The fact is that emergency room visits should be really rare, and should really not happen unless it's like some very unfortunate accident, so to say, in patients with well-managed asthma. I keep on repeating that if somebody has a well-managed asthma, they should actually have no emergency room visits or asthma exacerbations during the year. Sporadically, as a form of accident, let's say terrible cold, or somebody catches a flu and they have asthma exacerbation once a year, it may be considered to be okay. But if we have more than 2 asthma attacks that require emergency room visit, this is also a sign that the asthma is not well managed.